Let's talk about the names. Slavic languages are very...
Should be one of you joining us this morning. We're here at North Shore Medical with Dr. Davor, Dzepina. Doc, welcome to Bermuda.
Thank you very much.
First of all, let's talk about the name. You pronounce your last name.
My last name is Dzepina. It's not a very often name, even in my own country, so don't worry about the pronunciation. Even my own relatives sometimes do not know how to write it.
Okay.
But it's Dzepina.
Okay. I'll just say Dr. Davor.
Dr. Davor is okay.
Okay. Exactly what country you come from?
I'm coming from Croatia.
Croatia. Ah.
Yes. It's in the southern part of Europe, between the Italy and Greece and so Mediterranean Sea. Something similar as here in Bermuda.
Croatia experienced some war some time back, yeah?
Yes, but it was a long time ago.
Yeah, a long time.
Now,
how old were you? Were you there? Did you experience that?
Yeah, yes, I did.
Yeah.
I was young, but I remember everything. But fortunately, I didn't have to go to combat.
Okay.
Because as a doctor, I've served my medical obligations in
Very early.
Yes, very early. So, but I used to be born in Yugoslavia. It's even older.
That's right, Yugoslavia. That's right.
Yes, when there was another type of political political organization that was socialism then, and I served there as a young soldier in duration of 50 months at 18 years. So I passed.
And your direction towards being a doctor kind of got you out of that.
That's a very good question, because I still don't know exactly what took me to the medicine, because I was very focused on mathematics and technical disciplines. But you know, as older I get, that I realized that something made probably decision about it, because I stem from the medical family. My father was a surgeon and my mother is also a radiologist, so probably they influenced me to choose a medical study.
Would you consider yourself a specialist right now?
Yes, I am. I'm even more. I'm a subspecialist. You know, that's something that I personally don't like, this separation of medicine.
Okay.
Even early in our careers, we had to choose different pathways. So, for example, my specialty is otolaryngology. That means ear, nose, throat, and head and neck surgery. So, some doctors went to otology, some went to pediatric, and I personally am more involved in the facial plastic surgery and head and neck surgery. So that's...
We're going to catch up with that, because
something,
that is very, intriguing to me, ear, nose, and throat. We're going to come back to that. But welcome to Bermuda. What excites you most about joining the community at North Shore Medical?
You know, when I was planning to come to Bermuda, I did a little research about some specifics of life and work on the island. And also I had some useful information provided by the very kind North Shore Medical Aesthetic Center personnel, who gave me a lot of very, very good hints. And I got an insight into the breadth of current activities that are performed here, and also to those that are not. I'm actually looking forward to cooperation, you know, between professions such as internal medicine, pediatrics. That's something that I really need in my everyday work. And I'm expecting to be fully concentrated on helping the patients. That's first. In order to do that, I still need to catch some points about the healthcare environment, hospital organization, but also here at NMAC. NMAC. And as we are planning to do, my engagement helps that the NMAC Cares is a one-stop shop. One-stop shop is a little bit concept that can be very useful, but with caution. You know, sometimes the patients cannot simply get everything in a one coming. Most frequently they need something and they start from some point. And the first point in medicine, no matter my field or other, is diagnostic. Diagnostics is of utmost importance. That starts with the consultation, so a long conversation, and I personally invest a lot of time in a conversation. Then comes diagnostics, that means radiology, CT, etc., blood count, EKG, so. And then we make some synthesis of all of this data and can only then try to help the patient, at least to clear the situation and establish diagnosis. That's a starting point. And that's what I'm expecting from my Bermuda engagement. I don't know, will it be possible from beginning or will it take more time? Because a lot of my professional life, I am involved in a large university hospital. You know, university hospital environment means that you have everything on your hand. I mean, from my specialties, there are 25 otolaryngologists. I have them all around me. So if I need something, I can do it right away. Here in Bermuda, I think, I hope that I can get most, if not all of the information that I got, and if not, the patients will need to go to some other places. Probably I need to send the referrals, etc. But that still needs to be seen how does it goes.
Yourself, your practice across Europe, how does Bermuda feel different to basically where you've been other places around the world, both personally and professionally?
Yes, sure. Professionally, I can say that currently I'm fully engaged in my profession as never before. That means that currently I also work in Croatia and Austria, which are part of the European Union. I'm also registered in the United Kingdom, so I need to make very careful planning and organization of my time. In comparison to Bermuda, you know, there are always some similarities, some differences. Maybe some systems of medical care are partially different, you know, especially regarding the medical insurance systems in Europe that are a little bit different, but it's valid for the entire territorium of the European Union. I will definitely want to implement what my standards and criteria as a professional otolaryngologist is, that I need to have a diverse services, and which is something that I will insist that we here at NMAC have. You know, so yes, but I expect that in a relatively smaller communities, such as in Bermuda, I could not have all the logistics available to deal with all medical situations, but my experience will help to bypass it, and I'm sure that the patients will get the best of me.
What have you heard about Bermuda? I'm sure you've done your investigation before you even applied or was planning on coming to Bermuda.
I know that the Bermuda is some combination of native original culture, but also influence of the United Kingdom historically, but also the influence of the United States of America, because logistics are near here. And I also know and I'm aware of the very different population here, so multicultural diversity, and that's something that I like. and I'm looking forward to learn a lot about it. And of course, the Bermuda is something interesting for me because I love horticulture, I like plants, I like sea, food, so that's something that I expect to explore more during the next year.
It was surrounded by the ocean, so you got a lot of seafood.
Ah, yes. The Croatian has many islands.
Okay.
It's a relatively not so known fact for the tourists and people that are thinking about coming to Croatia. We have a large coastline and many islands. Some of these islands are as big as Bermuda, but in comparison to Bermuda, we have also 4 times of the year. So there is a real winter, there is a real summer, even hotter than in Bermuda,
Okay.
and other 2 as well. So something.
Have you ever experienced? Do you know how hot and warm it gets in Bermuda?
Yeah.
Yeah.
Yes, I know. I searched everything,
Okay.
and I know the average temperatures in during the summer. I know something about the humidity.
Okay.
So that's something that
something about the humidity.
Yeah, but you never have a temperatures over 40 degrees Celsius.
No.
So that's around 110 degrees, which we have in Croatia.
Yeah.
Whole August and September.
Okay.
So that's something you don't want to see and feel.
We have humidity that makes you feel like it.
Yes.
The energy is being sucked out of you, all the life and the moisture is being sucked out of you.
I still need to see that.
Yeah. We'll come back to you around September.
Definitely. We can talk more about the weather. And
so, Doc, as a global experienced ENT, ear, nose, and throat, or surgeon, can you briefly share with us some special, memorable moments in your overseas experience? A special case study of experience that sticks out to you?
Yes, that's a question that goes through my mind each day. There are those moments almost on a daily basis. I need to emphasize that I look at each patient as an individual, and each encounter creates something new and memorable. So there are many, many cases and situations. And on the other side, my profession is very diverse and covers many organs. Besides ear, nose, and throat, there are also neck with many complicated organs, different situations. Some of the patients are real patients. Some of the patients that has any other problems are coming to me. But it's always about establishing the good connection between the patient and the doctor. That's, sometimes the patient does not trust the doctor, has some fears or hears probably of hearing bad news, has some misconceptions, misunderstanding, has a false information through internet or AI today, which is often. This makes my job more and more difficult, and more is demanding on us. That requires constant learning and being at a knowledge source of information. So working as a doctor who spend most of the time in a large university hospital, where I could see many diseases, I feel that it's actually a blessing for me. Experience is gained much faster than when working in a small town or an institution that is not well equipped. I have in my career detected some very serious diseases at an early stage just because I suspected it, and I was very happy about it. These patients were without signs or symptoms. It's a very nice moment when I feel it and refer the patient to the other specialty and receive the call from this doctor, which is telling me that I was right. That was my memorable moment. It's nice also when I see young sportsman and athlete suffering with his career because he has a septal deviation, cannot breathe. And I operate him and his or her career suddenly blossoms. He is managed to do even more job, more performance, etc. You know, the patients with the snoring, that's something has to do with inner family issues. So there is no more snoring. Husband and wife can sleep together again, etc., etc. You know, but there are also some sad moments, I need to admit. That's the topic of the head and neck cancer. You know, sometimes if the patient comes early, we can do the job 100%. But sometimes in a small population number, this is not possible. And you know from the beginning that you will be a doctor who sees the patients, who treat the patients, but unfortunately you need to say him goodbye. That's a sad moment, and you need to be there 24 hours per day, not only for the patient, giving some support, not from medical point of view, but also psychological, social, treat his family, etc. So these are most memorable points in general. There are many more, but these are most important.
How many cases have you seen? I know you've only been here for a few weeks, and at one point
2 weeks.
Yeah, at one point we didn't have an ear, nose, and throat specialist on island. So you're going to see a lot of patients with these challenges. Your thoughts or expectations?
I gathered very small experience during these 2 weeks.
Okay.
And I can make conclusions about something. First of all, I see that many patients are taking too many medications.
Okay.
That's a big problem. You know, average patients, you know, I've seen average 10 patients per day, so that means 100 for the 2 weeks. Mm-hmm. I can say that 90% of the patients are taking more than 5 medications.
Overdiagnosed.
Which is mess.
Okay.
That can cause severe problems. We call it in medicine side effects. Okay. And side effects can be very different, unpredictable, even for doctors. Unfortunately, most of these problems happen in the head and neck area. Okay. Not to go into many details, so the patients are not aware of it. So I need to invest a lot of time to talk about, refer them back to the GP, etc., etc. The other problems, what I saw that many patients started to do some treatment or diagnostics and lost their ability to see the ENT doctor. So we need to come back to gather the documentations, to clear something, to get right insight, right information in order to continue their treatment or recommend surgery, etc., etc. And of course, there are many people that have many different medical problems, you know, different diagnoses, diabetes, high blood pressure, overweight. So I'm only one small part in that broad picture.
Okay. Many people think that ENT care is just sinus infections or tonsils. What serious conditions do ENT specialists actually help diagnose early?
You know, as I already mentioned, the otolaryngology and head and neck surgery is a medical and surgical specialty that deals with the diseases of the ear, nose, throat, head and neck. That's the definition. It includes both medical and surgical treatment of problems, but also it includes different ages of the patient. So there are different approach to children, different approach to adults, different approach to older population. For example, if we have a childhood problems, what can happen if the problems such as ear effusion or a tonsil, problem with the tonsils or adenoids are not detected on the right time, in the right place, it can lead to major problems later in life. So this simple examination can reveal some problems that can be solved by relatively minor surgeries such as tonsillectomy, adenoidectomy, or putting the grommets, etc., etc. In addition, you mentioned sinus problems. Everybody's talking about the sinus. There are also other structures around the sinus that are also important. The nose serves not only for breathing, but it serves also for warming, humidifying, and purifying the air. It has immunological role as well. There is also thyroid and parathyroid glands. That's a matter of endocrinology. The patient has a problem of that. And of course, I mentioned already head and neck tumors, which is totally different area. I need to have in order to competently deal with this patient, we need to have some team, like a tumor board. I need a radiologist, oncologist, internal medicine specialist, nuclear medicine, me as a surgeon, etc.
Where does the thyroid gland fit into part of your profession?
That's a very good question. Sometimes we made jokes out of it because I have feeling that our medical fathers and grandfathers didn't know what to do with the ear, nose, and throat. Said, don't give it. They put it just in a one place all together, and that was the name of the specialty. But yes, the question is very good. All of these spaces are linked,
okay.
Especially airways. So the ear is linked with the lungs, okay, because there are some spaces, some tunnels, some organs that all connect them. So the problem in one organ can cause the consequence in another. So there is some logic that is behind our understanding of the otolaryngology. Yes, there's also voice box or larynx. Mm-hmm. There's also esophagus here, hypopharynx, oral cavity, tongue.
Wow.
So we do it all.
It's incredible how this body is all connected.
Yes, sure. Yeah, but still, head and neck has ophthalmologists that deal with the eye, and have neurosurgeons that deal with the diseases of the brain and other structures and rest. And we have also maxillofacial surgery that deals more with the trauma, accidents. So, and the rest is on us.
Okay. How important is early consultation when it comes to chronic sinuses, throat issues, or air problems?
Yes, as in any field of medicine, the key to good approach is early detection of problems and the potential for disease occurrence in order to prevent the occurrence of the disease and, of course, subsequent morbidity. That means worsening of the disease. I personally dedicate a lot of time in my professional practice during consultation to understand who is before me, with who am I speaking. Most of these people, I see them for the first time. They see me for the first time. And it's important to listen carefully to the patient, ask questions, and only at the end look at the possible earlier medical documentation that the patient has. Sometimes he or she doesn't have it. In addition, clinical examination is necessary. You need to use our instruments to see. A lot of the spaces are in dark, so we need to have a good light to see and find if something goes wrong. And sometimes I even need a second consultation for the patients in order for me to think about what I just talked with the patient. Sometimes the patient needs a lot of time. I give them I often give them a couple of days to think about it, maybe to discover some new informations in order to prepare to ask me better questions, more focused questions, and have the clear picture of what is happening to them. So that's all part of the consultation that needs to be taken into account. My consultations can last very long. You know, my average consultations in this last 2 weeks was more than 1 hour. The longest one was 2 hours.
I heard you mention septoplasty.
Yes.
If one has that procedure, is it a one-off or is it revisited in 10 years? Does that sinus issue come back?
You know, the main idea and task for the surgeon is that the first surgery needs to be a last surgery. So if we fix the septum, put the cartilage bone in a middle position, everything post-operatively goes without complication. Patient is following our instructions, is careful about sports to avoid some contact sports, punches, etc. Then it's a long-term solution. But you mentioned sinuses. You know, sinuses can be also systematic disease. That means sinuses can be diseased, swollen, etc., as a consequence of allergy or some other type of the
Your environment has a lot to do with it.
Yes.
Okay.
And they don't know about it. So we order frequently allergy testings, blood testing, etc., because the patients are not aware. You know, especially in the humid area can happen. The bad housing conditions, food allergies, mold, of course, dust, grasses, you know, pollens, trees. It's all that can have a consequence. So sometimes when we make surgery of the paranasal sinuses, we cannot be sure for 100% if the cure will be long-lasting. And we need to inform the patients about it. They need to also use some nasal sprays, irrigations, and other medications.
Good stuff. What is the most, what misconception do patients commonly have about ear, nose, and throat care?
They think we are doctors for ear irrigation and sinus problems, you know. And it often happens that the patient is confused because he has prejudices or does not understand that there could be a problem even if nothing can be seen. You know, that's something what we call manifestations in the head and neck area of the problems that happen elsewhere in the organism. It's hard to understand, you know, but we need to explain to them. All patients are also surprised when I talk to them what I do all. They cannot understand if I can similarly do the children operation and also remove the larynx or remove one small gland which is 3 millimeters in the neck, or deal with the facial nerve paralysis, you know, facial paralysis after the infection. So that's all that we do. Patients are surprised to say, "Oh, can you do it really?" And on the other side, we have a huge field of aesthetic surgery. That's a hype about aesthetic surgery. Yes, I do it a lot, but the most important thing is the medical part. You know, they need to understand that, not to make a show business or.
Good stuff.
Yeah.
In today's world, we have social media, Instagram, TikTok. Confidence is often tried to be apparent. How do you define true confidence as a surgeon? How do you manipulate or when you see stuff on social media, take all the experts on social media, and then one has to come to you? I heard a doctor say just the other night at a function that
I need to be very aware, you know, and I need to be very good informed, because the patients can learn you something, and I can get into trouble if I don't know what are they talking about. Okay. And that takes time, even when I'm not on my work. But in any case, this question slowly enters the area of one's understanding of the personality, self-image, and the self-confidence. That's a main issue here. You know, in today's worlds of social media, TikToks, etc., many young people simply dive uncritically into this virtual world. and they lose touch with the reality. So I can freely and honestly say that we surgeons are losing this battle. We cannot deal with it, because we need to implement knowledge from psychiatry and psychology in order to keep pace. It can be very problematic if the patient asks you something that you cannot deliver and they don't understand it. If the patient is at this beginning moment unsatisfied, then I need to know how to deal with this situation. I can definitely say that the amount of my psychiatry literature in my ambulance is growing larger and larger. So, here, my personal opinion is generational change will play a big role here. So that probably some new doctors in the future will have similar attitudes as their patients, so they will be on a similar level, like a Generation Z, etc. Then the whole medicine will be maybe different when what today we have. But this is more the question for a philosophers or a futurologist. I consider myself the man of past.
Yes, sir.
But I'm personally a very conservative man. I don't deny that I have a huge knowledge. My knowledge spans 30 years of constantly learning, visiting, traveling, etc. Many books, many courses, many dissections, video courses, etc. So I have my basic weapons how to deal with it. So if somebody can fit into it, then I'm okay. Yes, but sometimes it's not possible.
Many young patients, many young people feel pressure to look perfect. How do you help them separate and gain their confidence? How do you help them to separate confidence and filter an unrealistic?
Yes, that's also part of previous question. I think I need to emphasize we need to go back to the basics of medicine. I have to be sure who is in front of me. Okay. There are so many different people, young people, older people, friends, cousins, father and daughter, daughter and mother, son and mother. So they come to me in all possible complications. So people are very different, The weird thing is, for example, what one patient asks for me to do, for example, facial plastic surgery, I need to concentrate to make a meaningful conversation, whatever conclusion we are about to achieve. And after this patient comes another patient, and he is stating that he wants everything but not what the first patient asked. So I need to switch, like a computer. Here everything was plus, and by the other, in 15 minutes is a minus. So sometimes these upside down logics can make a lot of difficulties for me. So I really need to be very careful and adapt to wishes in order to understand that particular personality. My approach as someone who is interviewing the patient, I have to be clear in my words from the beginning. So I clearly state this to the patient almost instantaneously what comes through my hand. There simply must be no place for ambiguity. Ambiguity leads to confusion, and confusion leads to a loss of patience. If I assess that something can be done and the patient has reasonable chances to be satisfied, then I suggest so, surgery or whatever any other type of aesthetic treatment. The satisfaction issue is a very variable concept. What is satisfaction? It's not possible to predict it with certainty, no matter how try I do it to do my best. Sometimes at the end, it's a catastrophe. It can lead to catastrophe. No matter what I do, what I can, all of my knowledge and the experience that I need. Sometimes the patients are simply like this type of personality. If I think that the patient is not suitable for the treatment, be it anatomically or, I don't know, psychologically, I say this and communicate this clearly to him or her, argument it the best I can. I thank them for the conversation and conclude it. So that's simply like this. No overpromise if you are talking about a facial plastic surgery. And of course, what is more ethically important, I don't have a problem to refer the patient to another doctor. That's something that we here in NMAC are blessed to have various types of specialties and doctors. What I cannot do, somebody other can.
How do you talk about facial plastic surgery, especially if someone has got a big nose and they want to make it a little more narrow and the English style nose. How do you comfort? How do you bring that person to reality if it can be done or not done?
You know, it depends on the patient, you know. Sometimes the patients are very realistic, are very intelligent, and the conversation goes smoothly.
Okay.
But sometimes I need to struggle with it. It's all about the risk assessment, like in any part of our lives. There are risks of the procedure, and also there are risky patients. You know, when I say risky patients, that means problematic type of personalities. We are talking about narcissistic personalities, perfectionists. Some patients are on mood-altering drugs. Too many of them, you know, suffer from depression and take antidepressants. These patients are not good candidates for any type of aesthetic surgery.
Okay.
Some of my colleagues do not accept them from the beginning. They have a questionnaire. If they have a diagnosis, no, sorry. But you know why? Because in a large majority, they are not satisfied.
With yourself.
They can never be satisfied. Yes, sure.
That's right.
Sure. They cannot stand the imperfections.
That they have.
Sure. And of course, there's a huge area of possible complications. I communicate it. So if there are possibility for complications, I tell them. I have approach to tell them my numbers. For example, you mentioned nose. I tell the patients that my complication rate is between 2 and 5%. And hear what they are thinking about it. You know, that's something, but I must see their reaction from their faces, from their questioning, etc. You know, because during the conversation, I realize it very quickly, because I know how to make the interview. And the patients must be realistic. If they accept everything, then only then they are the good candidate.
I appreciate what you just said, because it's very pertinent for some that are watching and going to watch this interview to totally understand their character defects. When you're not satisfied with yourself,
yes,
you keep wanting to change what you see.
Yes.
So I appreciate what you just said.
Thank you.
But very brilliant.
I need to know the motivation, you know. Motivation, why are you here? What's your problem in your life? You know, there are some patients that are not perfect from outside, but they are brilliant in their head. They are so friendly, so optimistic. And I tell them, don't do anything. You are beautiful as you are.
Yeah, don't change.
And I'm trying to, even not maybe in a first conversation, I deny surgery in them at the first time. If they come another time, then we can speak about it, because I know that they have really good motivations. So that are simple rules, but nevertheless, the aesthetic surgery is a very risky surgery. I have my opinion and call this type of surgery, it's a psychosurgery.
Okay. Well,
maybe someone doesn't want to hear that, but it's something like that.
Yeah, I appreciate the truth. How do you protect patients from regret after surgery?
Regret after surgery. I lead a serious conversation before.
So those starts at the beginning.
Yes. And tell them everything, how would they feel after the surgery.
Yes, sir.
I need to be there because many patients went psychological or emotional disturbances after the surgery. And I and my staff need to be there, my nurse Chris and other staff. They need to be so concentrated in order to recognize it, to communicate it with the patients and tell them, the swellings are yet present, the healing has not yet started, and there is a long way to the end result. We need to tell the patients and tell them that everything will be better with the passage of time. So that's the main approach. But of course, if the patient is emotionally unstable and not a good candidate, if we miss them in a triage before the surgery and keep this patient as a surgical candidate and deliver surgery, then we can have a trouble. And we need to do a lot more. It can be aggressivity, it can be a depression, In my career, I had a chance to deal with the patients that were trying to commit suicide. Unfortunately, not my patients, but there's a severe consequences of the unsuccessful facial plastic surgery. Destroyed families, money loss because of the second opinions, multiple surgeries, a loss of work. So it's not an easy situation. So as I already said, I need to be a psychiatrist.
I wanted to ask you, because we have a lot of cosmetic surgery individuals here in Bermuda that go overseas and get cosmetic surgery. Once that surgery takes place, do they need to go for every year, every 6 months, every 2 years for, I guess you would say, I don't want to say it how I say it, but for a follow-up?
Mm-hmm. We need to separate surgery from other types of aesthetic treatment, Aesthetic treatment such as, neuromodulators, such as Botox fillers, skin boosters, etc., which can be done here in our environment. In local anesthesia or even no anesthesia, they come from many reasons, so they just circulate. But regarding aesthetic surgery and follow-ups, if you ask me, what I think, what I need to secure for the patient, I will be here, not only for the operation, but also for the follow-ups.
Okay.
So that's not a problem. I don't like to leave the patients to another specialist or a nurse, to remove the sutures, to talk with the patients. That's something that I take as a more responsibility. That must be like this.
From start to finish.
Yes, and we here in NMAC are always here. We are focused, we are concentrated and active from 8 to late in the afternoon or evening, no matter what it takes. So they don't need to worry about it.
My second last question, what type of patients or conditions will you be focusing on during your visits?
I probably would expect and encounter good balance between real otolaryngologies, or the real diseases, conditions of the ENT patients, and head and neck surgery. And also, I expect that patients who previously had problems and could not come to see a doctor in the past, they lost the contact, so I can deal with it. But having said that, I'm broadly educated ENT doctor, but the logic in our profession is in, for example, is in any other profession like internal medicine, which is separated in cardiology, gastrointestinal, rheumatology, hematology, etc. So we are also sentenced in my profession to do some separate specialties. So that is the logic. And me being fellow in a facial plastic and reconstructive surgery, and I'm not, for example, specialist for audiology and balance and ears. So that's simply like this. Yeah. So I will try to do my best from the general point of view, but I mainly focus myself on a head and neck surgery.
What does what does patient first care truly mean to you?
That means that the establishing a communication is the best. Patient first needs that I'm a second, if you know what I mean. I listen. The patients are talking, and I can listen for 15 minutes, 20 minutes, and I also need to be very concentrated to remember what they said, not to browse outside to see the sea, because it can be very dangerous. And I'm very, very focused to hear everything what they say. That's patient first. So then, when they are finished, I return to the beginning of there and repeat their first sentence. So that's, of course, that that involves careful listening, but it also means expanding the topic. I ask them something else. Maybe they are afraid of telling me something. Maybe they do not think that something is not important, and I need to ask them, especially when we are talking about diseases that are caused by stress. Today, that can be reflux disease, that can be pain in the neck, that can be throat clearing, that can be headaches. Something else can be in a background going on, and they are not aware of it. There are many, I should say, the patients that are good at their profession, but they have a stress in the work. Struggling with the chief, salaries, etc., housing problems, etc., but they don't know what happens to them. And if I tell them that they have something, I tell them frequently that the organism gives them like a yellow card, like in a football. That's a yellow card. The next one would be red card. So you're out. Sometimes the stress disease can even lead to cancer or myocardial infarction. We have a very good doctor here at NMAC who is cardiologist. He can tell you everything about the stress diseases.
Good stuff.
So that's, yeah.
Good stuff. And finally, Doc, what message would you like to share with Bermuda as you begin this journey here at NMAC?
Okay, I hope that I can help in some ways, but I cannot promise that I am omnipotent man. I also ask for the patients, as I already, patients to stay with me for 45 minutes or 60. They can come in here. I'm here from them, only if they have any questions. And I need active involvement. That means share of responsibility. That's the main message to them, because it all starts with that. With my knowledge and experience, I expect that the people from Bermuda will benefit from my engagement.
Doc, we want to welcome you to Bermuda. I want to thank you for taking time out of your busy schedule.
Thank you for inviting me.
When you do come back, because you're leaving soon, when you do come back, we've got a lot of nice facilities that serve good seafood.
Looking forward.
And then when the warmer months come, you get some Bermuda fish.
Okay.
Some real good Bermuda fish. If you like to cook fish, just maybe
I like
200,
it.
100 yards away from you is a fishing spot where you can get your own fresh fish.
Oh,
These guys
I
down
will.
here, you can't cook.
I can, yes. Yeah, I know. I
Okay.
love fish. I love seafood. So
So
I'm really looking forward.
I do hope that you enjoy despite the caseload you might have, but do get some time to enjoy Bermuda.
I'll organize myself. Don't
Thank
worry.
you, Doc. Your name again. I don't want to mess it up, Doctor.
Davor Dzepina.
There you go, Bermuda. Thank you. Thank you for joining us here at North Shore Medical NMAC with Dr. Dzepina
Davor Dzepina.
and myself. I'm Trevor Lindsay. Do have a great day. Do have a great weekend. Do not drink and drive. The life you save could be young. Have a good day. Thank you, Doc.
You're welcome.